Welcome to Dateline Health. This is Fred Lipman coming to you from Nova Southeastern University. We have a returning star. We are lucky to have so many comments when Dr. Michael Kasper was here. And I've been reading some information about advancements in prostate cancer procedures, techniques, what you would call cure. So I said, instead of reading it, why don't I invite him back? And we're very happy to have you, Dr. Kasper. Dr. Michael Kasper is the medical director of radiation oncology at the Lynn Cancer Institute at Boca Raton General Hospital. Welcome back.
Thank you. It's great to be back.
Good to have you. And as I understand, we have a gentleman who, by the name of Timothy Scott. Timothy's a good name. You just missed St. Patrick's Day, but it's okay. The cancer, it was listed this way, so they listed you as a cancer survivor and a patient. So I don't know what else I can say about you, Mr. Scott, but that's what we have. Dr. Kasper. I know that if we start to talk about all the advancements right up front, we'll never get to Mr. Scott. So why don't we just sort of take up where we left off the last time we were on the show. And I know that there are some major changes, not only at Boca Raton Regional Hospital, but also in the techniques. And reading, as I said to you before the show, I've been reading a lot about some new techniques that I know that you're involved with in the treatment of prostate cancer. So it's all yours.
Well, thank you. As you know, prostate cancer is a hot topic. About 160,000 men will be diagnosed this year in this country with prostate cancer. And fortunately, most of those men will have low-risk disease and can be watched. But we still have about 30,000, almost 30,000 a year who die, and men diagnosed with intermediate risk or high-risk disease. Fortunately, we have some great new management and curative treatments and decreased toxicity in these treatments to offer these patients. So, that's why I'm here to share some of those techniques with you.
Good. And Mr. Scott, otherwise known as Timothy Scott, you are a patient of Dr. Kasper's, and it's all yours. You can say whatever you'd like to say about not how wonderful a person he is, and how good guy he is, but let's talk to us and the people out there who will watch us, just to listen to people like you. You're a patient, so talk to them.
Okay. Well, I think I was lucky that I got directed to Lynn Cancer Institute because I started the whole process up in Massachusetts, and after I was diagnosed, I spoke to a surgeon, spoke to a radiologist, and I kind of pursued some treatments up there. And I'd started it, and one of the parts of my treatment was a hormone therapy, and had one shot in November and had one in February, and I didn't feel like going all the way back up to Massachusetts just to get a shot for one day. So I had the shot here up in Boca, and then asked about treatments in the area and was referred to the Lynn Cancer Institute. Right. So I got a little lucky, I think.
You got lucky, huh? So tell me, Dr. Kasper, why did he get lucky?
Well, there's been a growing trend in radiation oncology for several years now, where we're trying to do fewer treatments for patients, as effective or more effective treatments, and hopefully lower toxicity. But in the past, as you know, patients would go for radiation and they'd be tied up every day for 6, 7, 8, even 9 weeks for prostate cancer. So we actually first did it with skin cancer, and developed some techniques where we're treating patients in as few as six fractions, where it'd be 6 treatments, where before it would be 5, 6, 7 weeks of treatment. We were now doing it in just 6 treatments. That went over fantastically well with the referring doctors and with the patients. Then the Lung cancer was a major advance in radiation oncology, where we were treating in 3 to 5 treatments solitary nodules that developed in Texas and spread like wildfire, and we're doing a lot of that now for the past several years. So that's been a major advance. Breast cancer as well, we're now treating patients in 1 week. And then prostate cancer has been late to the game, but it's come on gangbusters. Last November, the American Urologic Association and the American Association for Radiation Oncology put out a recommendation that all patients should be considered for a hypofractionated schedule of treatments. That means fewer treatments. There were 3 randomized trials that came out and outlined who would be a good candidate and how it should be done. And lo and behold, the treatment was as good or better. It certainly wasn't any worse than 9 weeks of treatment. So the standard became 4 to 6 weeks of treatment, and that's what the recommendation is now. Not everyone's following that, but we have taken it almost one step further. Along with that recommendation was consideration for ultra hypofractionation, and that is 1 week of treatment. Several places across the country, like Memorial Sloan Kettering, have been doing this ultra hypofractionation. It's been done at several places for 10, 12 years very successfully, and they've published their results. And we worked with them, got up to speed, and we've been doing that for several years now. So in just 5 treatments for low and favorable intermediate risk prostate cancer, we're able to deliver on the CyberKnife just 5 treatments to do what previously took us 9 weeks to do.
Well, let's talk a bit about the CyberKnife, because a lot of people don't understand what it is. And I mean, it's not literally a knife. In other words, they think of a knife as a cutting product, but it's an electronic thing. Explain to them.
That's great. That's an excellent point, because it sounds like it's surgery, and it is called stereotactic radiosurgery, but in fact there's no surgery at all. It's a bit of a misnomer. It is a great marketing name, but it's a basic type of radiation that is on a very precise robot. It's a miniature linear accelerator. A linear accelerator is what we usually use to produce radiation. It's a miniature linear accelerator mounted on an industrial robot, and it is incredibly precise, and it allows us to develop treatments where we give a very high dose of radiation very precisely. It actually moves with the patient. That's part of the robot, and it's got very sophisticated software and hardware to allow us to do these very advanced treatments.
So, patient Timothy Scott, how do you feel?
I feel great.
And I'm sure that you've heard from your physicians as to the results of your care. Would you mind sharing that with the public?
Yeah, I just had an annual follow-up about 2 weeks ago, and I had no side effects. I felt really, even during the treatment, great. Really absolutely felt nothing. And then just had my most recent blood work done, and my PSA level is at 0.8. So it's all worked out really well.
That's terrific. Well, you're a very fortunate individual, aren't you?
I am.
But probably a very logical and caring individual for yourself. I always tell the people who view us that their ability to have a good life is to take good care of themselves and not to just let things go. We just did a show prior to this show on interventional cardiology. And, some of the, I guess you could say, the indices that individuals just forget, I got a little fluttering, I lost my breath, I walked too many steps, whatever. But they don't realize what they should be doing is talking to their doctors, not to their neighbors and not to someone who's in a store somewhere, and they need to. And that's why I always ask the question, particularly of people who show up on the show who are patients. Other than being diagnosed, it's really your responsibility and your decision-making that enables the physician to apply their knowledge, their techniques, their capabilities to you. So you just proved to the folks out there that and I always say to them, take good care of yourself. You're a person who took good care of yourself.
Yeah, and part of my treatment with the hormone therapy, as they tell you, some of the side effects you'll get from that are hot flashes, maybe loss of muscle mass, weight gain. And I was 40 pounds heavier when I started it, and I thought there's no way I'm gonna gain any more weight. So I, consciously worked on losing weight, and then subsequently went for physicals afterwards. Everything, my cholesterol, my blood pressure, everything improved. So you do listen to your doctors.
That's right. Do listen to your doctor.
He's been a great patient, and truly kudos to you for losing weight, because it takes dedication, commitment, and a lot of hard work. So you've done well. That PSA will continue to drop. We're seeing with the F.A.C.R.O knife, the PSA go down to 0.1 or 0.2.
Really?
It can drop up to 2 years after treatment. And it's dropping faster and more substantially than we have traditionally seen. So we're very encouraged.
Maybe this goes a little bit outside of your, maybe not, maybe it does. But in talking to some urologists, some very well-known urologists, the PSA issue is not necessarily the most important thing to them. And I'm just generalizing what I've heard from them, because I think the general information that I got was that as long as it stays the same and you constantly, it's at a constant level, at a certain age you just forget about it. What's your thought?
I completely agree. So we treat the patient. We don't treat a number. And if it's staying the same, we agree there's nothing to worry about.
Like I said, I know of the tremendous advancement relative to investment that has gone on at Boca Raton Regional Hospital, particularly in the Lynn Cancer Center.
And we are very, very fortunate. We have so many generous individuals who have supported us, who believe in us, and who have invested in Boca Raton Regional Hospital and the Lynn Cancer Institute. So we are incredibly lucky to have state-of-the-art equipment, to have the best support, and have opportunities that I know I wouldn't have had I been somewhere else.
I would assume, Mr. Scott, that you had a urologist who was taking care of you, or who referred you to the Institute, or did you seek out the Institute based upon your knowledge of what they were doing?
Well, I started with a urologist in Boston.
Yes, sir.
And then since I decided I had originally started, when I was in Boston, I met with the surgeon. He asked if I wanted to meet with a radiologist. I did that. I did more research on different types of radiation, proton radiation, certain things. So I did that research. And then when I just needed one more, the shot for the hormone therapy, I was referred to a urologist up in Palm Beach County, and then he was the one that actually referred me then and eventually to the Lynn Cancer.
Well, yeah, obviously whoever the subspecialist is relative to radiation oncology,
Yeah.
and you mentioned the whole field of radiation oncology that you treat, but in this case it would be the urologist.
Yes.
So
That's correct.
So tell us about it. I did read, like I said, before the show I told you I was reading about some advancements in your area of cancer therapy. But let's get into some of that so the folks out here can know.
We spoke a second ago about some of the great support that we've had, and a good example would be with regard to a technique which spares the rectum when delivering the radiation. About 3 years ago, a new technique came on the scene called the F.A.C.R.O, and that was a type of hydrogel. It's a little gel that we insert between the rectum and the prostate that separates the rectum and the prostate enough so we can deliver a higher dose to the prostate while not giving the radiation to the rectum. And when we evaluated that, or we didn't do it, but when the studies evaluated that, they found that not only were we not irradiating the rectum, we were better able to give doses to the prostate and avoid other areas that we didn't want to treat as well. So sexual function improved, bladder control improved, and most importantly, the rectal toxicity was dramatically less. So that procedure was brand new about 3 years ago, and we wanted to do it. We wanted to bring it to our patients, but our ultrasound wasn't quite up to snuff. It's a very precise procedure with some needles going very deep into the pelvis between the prostate and the rectum. So we reached out, and within a couple of weeks, we had a new state-of-the-art ultrasound machine, and we were doing this procedure, able to offer it to our patients. We're still one of the few areas in South Florida that is able to do this procedure and offer that. And it takes about 15 minutes, 15 or 20 minutes. We do it right in our office. We put in gold fiducial markers at the same time, so it's 2 procedures in one. And patients go out, they do their treatment planning, and then they're ready to start a few days later, start their treatment. And the F.A.C.R.O, this gel that separates the rectum and prostate, stays in place for about 3 months and then slowly dissipates and is absorbed by the body and excreted through the urine over the next couple of months. So that's a good example of the cooperation and support that we've had from our generous supporters at the Lynn Cancer Institute, and some of the technology that we're able to rapidly bring in for our patients.
I have a query relative to the ultrasound. I would assume is being done by a technician or as a physician doing it.
No, we're doing that.
You're doing.
We're doing that. We're trained in reading that ultrasound,
Right.
Administering that ultrasound. I do have a nurse assistant who is helping me and attending to the patient. But it's a quick and easy procedure. You can talk, about that. Tim underwent that procedure, and he'll let you know how it went.
Well, Mr. Scott, go ahead.
Yeah, it was, other than the shot of the fear of 5 needles,
No.
I had no side effects. During the procedure, I think I had no effects from the radiation on the rectum, so I'm thrilled I had it.
Good.
We do a nerve block at the time of placement of this, so we stick a needle in on either side and numb up the nerves at the apex of the prostate, and then we put in the gold markers, usually 3 or 4 gold markers right into the prostate, and then 1 additional needle to put in the F.A.C.R.O. So that's how it.
And the markers and the needle, I would assume, are the guideposts for the radiation therapy. Is that correct?
That's exactly right. We're able to use those. The CyberKnife can see them and be extremely precise. If there's any movement at all, if there's gas or if there's a bowel movement, if there's any shift, the CyberKnife will adjust along with those markers.
Yeah. Because again, getting back to the CyberKnife, I'm going to repeat this one more time for the viewers. It is not a knife.
But you're right. It's not a knife. It's a type of radiation. In the brand, the generic name is stereotactic body radiotherapy, or SABR, stereotactic ablative radiation. So it's also known as either SBRT or SABR.
So it came out a lot easier just to say CyberKnife.
I think they think it's sexier.
Okay, whatever. So, Dr. Kasper, again, I know Mr. Scott is here as a cancer survivor and a patient relative to prostate cancer, but there is so much going on, and you did mention at the top of the show the work that's being done relative to the utilization of radiation. It's rather dramatic, really.
It is. We're recognizing more and more patients that are appropriate. For a few years, we were getting away from testing and we weren't seeing as many patients. And then all of a sudden, we started seeing more high-risk patients that had more advanced disease. So I think we've de-emphasized the don't get the PSA, for instance. I think more men are getting a PSA. And I think it's good to know. Doesn't mean you have to treat. And as I said at the top of the show, many of the men with low-risk prostate cancer, we're watching. And they're going to do perfectly fine without treatment. But I think it is worthwhile finding out whether or not you have intermediate risk or high risk prostate cancer, because that can be a real problem in a very short period of time.
And how does one know whether you have intermediate or high risk?
Well, first you get tested with PSA. A major advance has been the integration of MRI, specifically multi-parametric MRIs, which are designed to evaluate the prostate and show us areas that may contain high-risk disease. That has actually guided biopsies and made biopsies much more fruitful. Biopsies in the past were pretty much, will go into 12 different quadrants of the prostate, and it's a little bit random, really. They're in specific areas, but you could have disease right next to it and potentially miss it. Now on the MRI, we're using that to guide the biopsy. We'll do those 12 quadrant biopsies, but we'll make sure that we're hitting any areas that look suspicious on the MRI. And that has been very fruitful in finding those men at greatest risk. We look at the MRI with a special radiologist we're very fortunate at the Lynn Cancer Institute. We have specialists in prostate cancer. We have specialists in radiologists who do just prostate cancer, specialists in radiation that do just prostate cancer. So everybody is subspecialized. And we go to different meetings and we talk, national meetings, and we talk about the latest techniques, and they're highly trained in how to identify these areas. So we're very fortunate to have an outstanding team of radiologists who look at these MRIs and know what is suspicious and guide us. And that's quickly becoming the standard across the country.
Do I assume, Mr. Scott, that since you were, I guess, told and advised by the physicians in Boston, that did they provide you with any of these techniques so that when it got to Dr. Kasper, or did he have to, I guess, analyze some additional?
They did. I did have an MRI, right. So part of that the reason was that I did have a nodule on my prostate, and as I was contemplating between surgery or radiation, where the one nodule was, and if I was to have surgery, the possibility of I guess sexual dysfunction would have been greater if they would have had to take out more of the nerves. So the MRI was presented to me, and partially I did it, for more knowledge for that. So I think that was, for me, it was helpful.
Okay,
Yeah.
well, that's important.
Yeah.
Because the people out there are listening to you. Even though Dr. Kasper's the expert, they're watching to hear what you have to say. Thank you very much for being here. We're down to the last minute and a half of this show, so I want to thank you personally for coming forward and letting the people out there know that you're no different than they are, and that they are listening to you. Yeah. Even though we have an expert sitting here, you'd be surprised how one neighbor tells another neighbor, or has another friend tells
Yes.
another friend, and you have a very strong influence on what they understand.
Yes.
I mean, that's just the reality, So thank you very much for coming forward. We appreciate you being here. And Dr. Kasper, what can I tell you? I mean, every time I turn around, I read more and more about the techniques and what you're doing. And one more time, this is the second time we've seen you here, and you have provided a tremendous amount of information. Thank you very much for being here again. We appreciate it, and congratulations on the evolution, the constant evolution of the Lynn Cancer Institute at Boca Raton Regional Hospital. So we wish you well.
Thank you.
We hope to see you again. Whenever you want to come back, just let us know.
It's been my pleasure.
Folks, we try to bring you some information relative to what we think is some knowledge about advancements in prostate cancer treatment. And just remember that, again, you've got to see your doctors, you've got to get those tests, right?
Yes.
Tim Scott,
Yep.
right?
Absolutely.
You wouldn't know unless the
Right.
tests were done.
Yeah.
And it's not all that bad. Everything, the physicians and the hospitals want to make it pleasant for you, as pleasant as it can be. But they will give you your health, and it's sometimes even your life. How about that? So thank you again for showing up. Remember, this is your show. If you have any questions, you have any statements to make, there's the telephone number and email address. And remember, as I always tell you, this is your show, so whatever you want to know about, let us know. The show is called Dateline Health. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see you.